Good day to everyone. My name is Dina, and I'm one of the team here at Elderwerks Educational Services. We are a non-for-profit that focuses on everything aging and helping seniors have the best life possible. Today, I am joined by Dr. Joshua Levine. He is a licensed clinical neuropsychologist with a passion for patient care and over 20 years experience. He founded NeuroClinics and Assessments, and it specializes in the evaluation and diagnosis of brain injuries, illness, and dysfunction. He is on staff at the Neurological Department of Northwestern Medicine Hospital for both Huntley, Woodstock, and McHenry. Dr. Josh, we're so happy to have you joining us today for this special presentation about everything that you wanted to know about neuropsych testing, but are just too afraid to ask. So let's get into it. We're going to go through some questions today, and this will just be a friendly dialogue between the two of us. Can you tell me what a neuropsychologist is? It's a big word, and it sounds sort of scary.
So a neuropsychologist is a clinical psychologist who then goes on to get specialized training. We do what is called a fellowship. It's functionally like a residency, but it's 2 years of specialized training in brain issues, brain anatomy, brain functions. And then we go on, and as clinical neuropsychologists, we use that training to help diagnose and understand the effects of the injuries and illnesses in order to help other doctors and other treatment providers figure out how to best help their patients.
A neuropsychologist isn't as scary now. Then we know that you're just helping with brain health and understanding of the functions. So one of the things that I think is scary to people is why we did this question and answer today is about that neurological testing or evaluation. Testing and evaluation are, correct me if I'm wrong, basically the same word, but tell me what a neuropsychological test is.
Sure. So first off, what I like to tell people is that, yes, I can understand that going to any doctor can be scary, and especially going to a doctor when it's considering a brain issue can be scary for people. We are really just taking a snapshot, a picture per se, of exactly where a person is at that point in time. To do that, we do a bunch of different tests because the brain is capable of a lot of different things. So we do a bunch of little tests to kind of come through and measure all of those different functions. Now, I keep saying functions. What am I talking about? Well, I'm talking about things like memory. Memory is usually one of our major concerns, to see if people are forgetting. But not only are people forgetting, but how are they learning information? How are they processing that information? How are they retaining that information? And we get to look at the different steps that are involved in the memory process to see, is that functioning the way that it should be? And if it's not, the ways in which it's not functioning can give us some information about why that might be. And that's part of how we do our diagnosis. Other different areas that we look at are things like attention, focus, and concentration. We give you things to focus on and see how it is and how well you can do that. For spatial ability, which is basically how your brain is interpreting visual information. We might give you some tasks that involve in looking at objects, and can you repeat this object? Can you organize this object together? Things of that nature. If we're looking at language skills. We might have you try to name a bunch of objects, or we might have you try to come up with a list of words. Also things like executive functioning, which are things like logic, order, planning, organization. All of those things put together really help us to understand how the brain's working. There's also some auxiliary things like motor functioning. How quickly are you doing things? How strong are you? Do you have the strength that we expect? And then lastly, we look at emotional functioning, because a lot of people don't realize that those mood symptoms can also be responsible for affecting some of the other areas. So, for example, what a lot of people don't realize is that as we get older, especially, symptoms like depression can really present as memory loss. Symptoms like anxiety can really present as difficulties with focus and concentration. So it's really important to kind of know everything that might be affecting somebody so that we can figure out why they're having those issues. At worst, it's boring. At best, you might kind of like it if you like puzzles, but we get you through it. We put it all together, and then we get really a nice picture or kind of a pseudo map of the brain and how that brain is functioning.
So is this a test that I just like call your office and say, I want to do this? Or would this be a test that a doctor would recommend, and why would a doctor recommend this testing?
Oh, sure. So honestly, you could do both. If you have a good reason, we're not just going to test you for fun, but if you have a good reason or have a concern, then we can always explore that. But yes, oftentimes your doctor does refer you to us. And so there are lots of different types of doctors that will refer to us. Lots of primary care doctors refer to us. Neurologists refer to us quite a bit. But really lots of other doctors will too, especially if there's some reason for them to suspect that there might be some sort of change in the way that a person's thinking, the way that a person's acting, the way that a person's remembering. So that it could be just as simple as that. Sometimes they just want to check things out to make sure that it's not something else. And we're happy to fill that. Sometimes there is a concern and we're trying to figure out, well, how much of a concern is it? Is it just like a little bit of a concern? Is there something we can do about it? Is there a medication that will help? And that's how we move forward on that.
I know in my past, I've had people say, well, I don't want to go for that because they're just going to drug me or they're just going to put me on meds. Can you explain what your role is with the testing and how it would potentially affect somebody either being on medication or not?
Sure. And that's a wonderful question, Dita, because if a person is coming to us, they're usually coming to us for a reason. There's something that's off. We might not know what it is, but there's something that's off. And if we then determine that there is something that's off, then sometimes what we see, whether it be depression or whether it be some type of change in the brain, can be responsive to medication. It's something that could help. Now, we don't force medication on anybody. We're not saying, yes, you have to take these things, but we are saying, hey, we've identified this issue and here's a list of the things that can help, one of which is medication. You can talk to your doctor about that. And if they want to prescribe a medication to you to help with that, then you can do that. And if they don't, that's fine too. Or if for some reason you don't want to take it, then that's fine too. That's still your choice. We just try to identify what might help, and then it's your choice whether or not to follow through. As neuropsychologists, we are not treaters, we are diagnostic specialists. We specialize in figuring out what is going on, whether there is something, whether there's not something, the extent of that, and what's the cause. So as diagnostic specialists, we figure it out, and then we hand it over to whatever provider is most appropriate to follow up with treatment for that.
Can you tell me a little bit about how long that testing goes? What does that look like in timing? And am I in front of a computer? And am I trying to write things down if I would go for neuropsychological testing?
Yeah. So when you come in for a neuropsychological test, the very first thing that we're going to do, we do what we call an interview. we call it an interview because we're just going to ask you some questions. We're going to ask some background questions like, oh, where'd you grow up? What's your family look like? That type of thing. Nothing too personal in that section. How far did you go in school? What'd you do for work? Just, it gives us an idea of where a person's at and maybe how we think that they should be performing on some of these tasks. If there was any reason why they might struggle with something. We also get their medical history. We go through a bunch of different medical symptoms that might be related. We go through psychological symptoms that might be related and get all that information. So that's just our sit down. And usually when they come through the door, the very first thing I say is like, hey, tell me what's bringing you in here. Why are you here? And sometimes they're like, hey, I've been having this issue where I just feel like I'm struggling to remember. I'm like, okay, tell me about that. What's it look like? When did it start? All of that. So I just can get that information from your own mouth about how you feel things are going. Sometimes it's, well, my kids wanted me to come. And that's fine too. Like sometimes people are just doing this to make their families feel better, and that's okay. Then we move on to the testing piece. And in that interview, I have already decided, okay, you've told me that these are the issues that you're thinking are there. I've looked at what sort of medical issues might be at play. Here's the tests I think might best explore where your brain's at and what type of issues might be at play, if any, right? And so then I design what we call a battery of tests. So it's just a listing of tests that I want the person to complete to let me identify if there's anything wrong or if there is anything that has changed. And then they move on to that testing piece. Now, the testing piece will depend on why they're here. It depends on what things I have figured out within the interview. So the testing piece can really vary in terms of length. It's usually a little bit longer. It's usually a couple hours where we're sitting down and testing these different functions, because there's a lot of little functions. To just say memory, I can't give you just one test. I got to give you quite a few different little ones to see how are you learning? How are you learning visual information? How are you learning auditory information? How are you learning just unrelated information or contextual related information? All sorts of things like that. And so that gives me a lot more information to go on when I'm hitting the end. So usually it's going to take a couple hours. If you need breaks, we give people breaks. If you want to break it up and come back another day and finish, that's fine too. It's whatever people need. We're pretty flexible with getting them through the process.
How does someone prepare for the testing? Should I bring water and food with me? Do I need a good 8 hours sleep? What do I need to do to prepare for a neuropsych test?
It's an excellent question. So first, I want to say this is not a test you can study for, so you don't have to worry about it, and it's not a test that you'd have to study for. So in terms of that type of preparation, there's none. So no midnight cramming the night before. I do want people to try to get a good night's sleep as best they can. I know some of our people are coming in because they have sleep issues, and the sleep issues are what's causing memory issues or attention issues. But try to get as best to sleep as you can. Try to make sure that you've eaten at least something in the morning if that's your normal routine. Sometimes people will get a little nervous before they come in, so they don't feel like eating as much. Happy if people bring in snacks. I'm happy if people bring in drinks. The only thing we ask is that people aren't drinking like too much caffeine before the testing, because that can change performance a little bit. And there's a very, very small amount of medications that we ask people if they're taking them before the test that we want to know about. But generally speaking, bring a snack, bring a drink, and just try to come as rested as possible. That's the best way that you can prepare. The only other piece that is really happy and helpful for me is if you bring in a list of your medications. That is wonderful. Or if you want to go through and figure out some of your medical history, if it's a little bit shaky, that's fine too. We're going to go over it in session anyway, but just sometimes people like having it with them because it's easier to figure out the night before instead of when I'm sitting there putting you on the spot.
When they do the intake at your office and set that appointment, they may be able to provide some of that information ahead of time so that you have it, correct?
Yes,
Perfect.
absolutely.
That helps. I'm going to go to a couple of questions that I know we've been asked here at Elderwerks. And one of those questions are they doing this so they can take away my independence and take away my car? Is this what that test is going to show? Can you address that question? Because I know it's a big fear for some adults that are being tested. Even I know you do some young adults as well in testing. So I think that's a fair question.
Yeah, and it's something that we get from a lot of people, especially when they're coming through our door. They're nervous. They're like, "What are you going to do? Are you going to lock me up? Are they bringing in the white coats?" That's not what we do, and I'm always happy to tell people that. Like, that's not what we do. We're not here to lock anybody up. We are just trying to figure out why people are struggling, and that helps us to help their doctors. Now, if someone is having struggles with, say, they're forgetting to take their medications, and we find that there's some memory issues where they're forgetting to take their medications, one of our recommendations at the end is probably going to be, hey, having someone keep an eye on your medications just to make sure that you're taking them okay. Like, let's get pill boxes. Let's figure out what we can do to try to keep you functioning as best you can and get the things that you need for your own health and safety, according to whatever it is that we find. That's what we're doing, is we're just identifying the need. We're not taking anybody and locking them up. We're just trying to help people so that they can stay healthy and happy and within whatever environment they're in, as long as they possibly can be. So
yeah, it really sounds like this is the neuropsychological testing is really a tool to help individuals stay as independent as possible and have the best quality of life, because this is a tool that gives sort of, as you said, a roadmap to other things in their life and helping with that. That being said, when we look at these this testing, when somebody comes in and has that, how long till they get results? Are they getting results same day? Is there a lot of analysis that goes into it? And how do I get those results? And if it's for myself or for a loved one, how do I use those results?
I kind of hear two things I want to answer there. Can I bookmark the results question? And I just want to hit on something you said, which was the roadmap piece. And I think that's a really important concept to address, is that with the testing and with the results, oftentimes we are figuring out what is the issue. Because I will say, far too often people will jump to what is the most common thing. And let's be frank, the most common there's two most common forms of memory loss. One is just getting older, and the second is Alzheimer's disease, right? And that's the big scary one. And
Yeah.
just because someone's having memory loss does not mean that it's Alzheimer's disease. And a lot of times people are coming in with Alzheimer's disease, and they may have some like mild form of memory loss that's not Alzheimer's disease. And they actually feel a lot better because they know that. And then by way of that roadmap, we're saying like, hey, this doesn't seem like it's a progressive issue. This is a mild issue. Here's the things that you can do to address it, which is a very different roadmap or resulting picture from, oh my gosh, this is Alzheimer's. Yes, we do sometimes say like, hey, this is Alzheimer's. But knowing what it is also helps a person to prepare. And so being able to say like, no, this isn't, this is something else that should be addressed in a different way, can be really helpful to people and really give them that peace of mind. After a person is done testing, usually we're somewhere about 2 to 3 weeks for the results. Now, the reason for that delay is there's a few. Number one, it takes us a little while to score up all of that testing. So the testing is, again, pretty involved. If you're producing all that testing, we have to come in and we're using these sort of complicated statistical methods to figure everything out. And then we're putting it all together. It also takes time to put that all together. I've got to look at that. I've got to look at your medical history. I've got to look at your medical symptoms, reports from anything else, and then also try to look at whatever doctors that you've been to, and I try to get to see, like, what have they seen? What are their issues? And so I'm taking all of those pieces together, and then I'm looking at how that person's performing. That takes a little bit. We have to chew on it a bit. Okay. And sometimes it takes a little while for the other places to get their medical records over to us. So we try to give ourselves a little lag time to get those things. So generally speaking, we're about 2 to 3 weeks. And sometimes will be a little bit longer if we really need those medical records and there's been a delay, but we always try to communicate that to a person too.
So when those results come out, is that a simple report that comes to me in the mail or on something like my chart? Does it go to my doctor, and does my doctor sit down with me? Do you sit down with me? That's a lot of questions I just asked at once, but I know you can answer it.
Thank you. Yeah, so when we are finished with the report, in some cases, and it kind of depends on your insurance, but in some cases we sit down and we have what we call a feedback appointment, where we go over the results with the person, with the patient's family, and we can arrange things like that if they're needed anyway. But once we are done, we send that report to whomever you have identified. If it's your referring doctor, we're almost always sending a report over to them, unless for some reason you really didn't want it to go over to them. Well, this is your health information. You're the one in charge of it. You're the one who gets to say who that report goes to. If you want to look it over first and figure out then who to send it to, that's fine with us too. We respect those rights. So you figure out who you want it to go to. If you want it to go to your physician, if you want it to go to your neurologist, we send it to them. If you want a copy sent to your brother, we send a copy to your brother. If you want a copy sent to your kids, we send a copy to your kids. You're the one who makes those decisions, and then we send out the report to whomever you like. The nice part about that is that anyone involved really gets to express their concerns, express what they've seen, provide that information to us, and then we get to help that person understand what's going on. So helping not only the patient understand, which is really the most important piece, the patient's doctors to understand, the patient's other care providers to understand, but also the family. And having a loved one who you're worried about can be one of the worst things. I know this personally, right? So I know how that goes. And it's scary, and you're worried, and you want to know, and you want to do what's best for them. You want to do what's right by them. And being able to help the family in addition to the patient is really just another really rewarding part of this job.
Another question, if somebody had some testing done, is this something you repeat every 5 years? Do you repeat something like this every year? Does it depend on the diagnosis? How does that work?
Yeah, so our testing and the way that we approach it is to figure out what an issue is. If we've figured out what an issue is, then unless something's changed or unless a new question gets raised, then there's usually not a reason to repeat the testing. If there is a reason, we're happy to, right? But there has to be a reason. And I say that usually comes with a question, which is, has the diagnosis changed? Is there something new here? Has a person continued to decline in functioning? Has a person gotten better? Does this person need assistance with this thing that they didn't need it before? Like suddenly, I'm wondering if they are struggling with their medications and they need to have some assistance there. Anytime there's that type of question, that's usually when we get consulted. And if you've seen me before, you'll know that my standard answer is just call me. Just call first. Like, I'm happy to take that phone call and just, hey, what's been going on? Why do you think you need a reeval? Listen to your issue. Okay. I think you could come in, we can do a reeval, great. Or, honestly, that's right in the realm of what we'd expect. I don't think you need to do a reeval. Call me if there's anything else. But if you really, really want to come in, sure, we can talk about that too. But generally speaking, is there a question? And then even if there's a question, let me know, and then we'll figure out if you need to come back.
Another question that we've gotten is neuropsychological testing going to tell me what type of dementia I have, whether it's Alzheimer's or vascular or Lewy body or the other, at last count, 145 other kinds of dementias out there? Is the testing going to tell me that, or is there more to it?
So what neuropsychological testing can do is to tell a person not only if they're having issues that are greater than expected, like, is there a memory issue? What level of that memory issue is there? Is it just a little bit? Is it a little bit more? Is it a lot? But also, very often, we are able to determine what we call the etiology, the cause, the source. And we do that by looking at patterns. Okay, so certain testing results, which are just related to brain functions, so certain brain functions are affected differently by different disease processes, by different injury processes. And that's how we look and determine, like, is this an Alzheimer's process? Does this look like Alzheimer's disease? Is it impacting the things that Alzheimer's disease impacts? Or does it look more like a vascular dementia? Does it look more like a Lewy body dementia, right? And that's also part of the reason why we get all the medical information. And then we also really try to work in concert with neurology, because neurology is doing imaging, they're doing neurological exams, and we get all of that information. And so we have one piece of the puzzle, they have another piece of the puzzle, we put it all together and then look at and interpret that. And really, not always are we able to, but very often we are able to look at this and be like, yeah, this is pretty certain to be an Alzheimer's. Yes, this is pretty certain to be vascular. Yes, this is pretty certain to be Lewy body dementia. We're not, 100%, but things very rarely are. We are very good at what we do.
Well, I thank you. I think you've taken the scary and the I'm afraid of doing the neuropsych testing. I think you've answered all of these questions in such a wonderful way that it is more approachable.
Thank you. It was really a pleasure.